schools, back to our families. I want to share with you that we have approximately 20 people in the district's leadership team who are working on specific actions in the event that the current state were to worsen, or in the event that there needs to be clarity with regards to how schools would function, what would be some of the core processes in the event that there is more emphasis with regards to illness or anything to that effect. We are currently identifying thresholds, if you would, making sure that we can dictate or best project the number of students who are absent, who are able to, in some ways, communicate if there should be a heightened alert or a heightened awareness around an infestation of a school or any type of contagious disease or anything to that effect. We are in front of all of those components. I also want to share with you that not only are we monitoring these events, not only are we monitoring attendance of our students, we're also monitoring attendance of our staff. And I want to reiterate what Dr. Jones has said. Staff members, if you are ill, if you have not had the opportunity to seek medical help to ensure that you're able to work, please don't come. We will look at case-by-case natures in the event that someone has a concern with regards to leave policies or leave banks or anything to that effect. Ultimately, this is an interrelated environment. We recognize the importance of making sure that we have the appropriate processes and the appropriate information in place so that our families and our students and our staff are well informed. I want to make sure that the district is doing all that it can, and we're sharing that information with you. We recognize that in some ways, in some ways, this is the season for illness. We are not looking to create a sense of urgency if there isn't one, but at the same time, we do want to make sure that we are looking at the data, that we are using the data to inform our decisions, and that we're able to communicate those decisions and those plans with you in a timely manner. At this time, I would like to introduce Mr. Spencer Hawkins of the Macon Bibb EMA, who will also be able to talk about some of the work that we're doing in partnership to best protect our citizens, our students, and our staff. Spencer?
Thank you, Keith. My name is Spencer Hawkins. I'm the Emergency Management Director for Macon Bibb County. We are preparing for this just like we would whether it was a tornado, hurricane, or any other disaster that we may be facing. We have partnerships, we have relationships built and in place that have been built over time so that we all can work together to respond to and recover from anything that may happen, whether it's COVID-19, the next flood, or the next storm. We continue to meet before, during, and after about COVID-19. We're working closely with the Bibb County School District as well as all of our other schools and community partners to ensure that everyone is informed on the latest information and that everyone can make wise and informed decisions before, during, and after a potential impact for this. Thank you very much for that time. I'd now like to introduce Michael Hoganson with the Department of Health.
Good afternoon, everyone. Just a short update on the Georgia and local side of things. Here in Georgia, locally, we have 6 confirmed cases of COVID-19. At this time, we have absolutely nothing in our 13-county district, which does include Macon Bibb County. As Spencer said, we're also working to establish relationships as well as continue to build the ones that we already have in place. We are in constant communication with our healthcare partners, schools, emergency management agencies, law enforcement, providing not only information as we get it from the state office and from the federal offices involved in this ongoing response. We're also providing guidance documentation that they can use to not only beef up their plans, but include something a little bit new that will help in response to COVID-19. We urge everyone to seek out information from appropriate sources. We know that there are ample opportunities for rumors to be generated anytime a new strain of anything is out there. We are aware that there are rumors flooding our community. We are doing what we can to combat those rumors, and we ask that you do the same. if you're sharing information, make sure you're using reputable sources, use the CDC, use the World Health Organization, and use Georgia Department of Public Health for those accurate case counts rather than just seeing something on social media and pushing that forward button. We ask that you vet the information, you make sure it's coming from a credible source before using it in any sort of community environment. Thank you.
Thank you, sir. Well, thank you, Michael, and thank you, Spencer. Our right-hand person who leads this effort for us is David Gowan. I had not told David I was going to give him an opportunity to speak, but David, anything you want to add?
Thank you, Dr. Jones. We want to make sure our parents and our school community do understand that we are taking this situation very seriously. We do have a management team that Chief Simmons referenced. We're having an infectious disease response plan that we are working on, we're reviewing. It has many elements, and we meet regularly. And I will just say that we do have close coordination with Macon Bibb County EMA, the North Central Health District, and these are relationships that have been built over a matter of years. They're not very recent, and those are very helpful in our operations in the school district. Those are critical relationships. And also, we want to reiterate the proper procedures, washing your hands, social distance, all of those things that we've sent out to try to reduce the chance of the spread of this virus. With that, I'll turn it back over to Dr. Jones. Thank you.
Thank you, sir. I saw an email that came today from Richard Woods, our state school superintendent, and he said, "We advise all Georgia school districts to continue to follow the guidance of the Georgia Department of Public Health and the local boards of health. At this time, school closures are not recommended for areas." And so I just want you to know that we're fully involved. One of our core values is open communication, and this is one way that we're trying to demonstrate that. We believe in transparency, and we believe in having honesty and honor lead our efforts. I think since 2015, I tried to lead that. We've tried to show that we are a part of a team that's working, and that's what you see before you today. And with that, I will ask, do you have any questions of us before we end this?
What's kind of the emergency plan if something were to impact our area?
So I think it falls into two parts. One, if something falls into our area, Mr. Gowan, Spencer Hawkins, they're going to have the team that's going to be operating, and that group will help us decide what's best. I want you to know it's not going to be a decision made by one person. It's an effort for us to provide the very best decisions that we can make for the area, and so it's not one. So it's going to be based upon the timing and the situation and what it is that we know at that point in time, because this continues to be an evolving situation.
Do you have like a...
One sec, you want to add anything to that, guys?
No, Dr. Jones is absolutely right. Because of the issue with this event, obviously the health department would take the lead on a lot of our decision-making processes. We'd work closely with our medical partners here in the community, and depending on where the infection came from, we'd work with that appropriate agency, whether it be the school board or one of our local agencies or something like that. Once again, reiterating the fact we have a team. We are practiced in this. Between all of the hurricanes and the storms and the things that we do, this team is prepared and ready, and we know how to respond.
Dr. Jones, to follow up on that, Fulton County, as you know, they just closed down yesterday, and they're working on a digital plan. Is there a digital plan that you guys would consider as well?
Yes, we do have a plan, and we're continuing to revise it. As you know, one of our initiatives is to have students bring their own devices at this point in time. The e-Splash that was recently passed is now going to get us to a one-to-one. As we move from one plan to another, we're working to see who has devices. So once this briefing is over, our staff is going to send out an email to our parents and we're going to ask, what devices do you have? What technology do you have internet, so that we're able to continue to prepare. We're using several different softwares now, and I'm pretty confident, I take that back, I'm very confident that we're going to be fine. We've been able to do it before.
I'm going to use my son as an example. He's at, I think, 4 or 5 missed days with this coronavirus outbreak. If someone were to exceed past those 6 excused days, will there be repercussions?
So if a student is absent, we're going to have to go through our regular protocol. The question becomes, what did they miss, what needs to be made up, and what is the impact? Our teachers and principals have done a great job of working with students, not only for regular illness, but the flu, because you can be out for a period of time. And so I would ask people to look at what we've done in the past and what other people tell you happens when their children are absent. We're going to work with you. It doesn't do us any good not to provide makeup work or to help in that regard.
Have you all seen an uptick in absences?
We have not seen an uptick in absences. We have had some information in isolated situations where some people have just said, I'm keeping my child home. And that's because they have flu symptoms, and with those symptoms, they're just being cautious. And what we advise is that if you have a fever, keep them home until the fever is below 104 and getting back down to normal measures. Stacy, did I say that right? 100.4. Thank you, ma'am. See, I told you, I got help.
Now, earlier you did talk about some concerns when it came to soap in the schools. Can you kind of elaborate on that? Which schools, how many schools, how long has this been a concern?
So our operations team has always had soap. We've always made it available for schools to use. In order to get students into classrooms and get them out, we've also started using hand sanitizers. And in some schools, they use hand sanitizer more than they use soap. We just said that now with what's going on, we're going to provide more guidance, and kids can use hot water, soap, and then when they come out, you can still use a hand sanitizer. That's what we're doing. And truthfully, I cannot identify one school that's been across the board.
That you all have heard concerns?
It's been across the board that we've had concerns where people have said some bathrooms don't have it, or teachers are not encouraging students to use it.
How long have you all been hearing that?
Oh, I can't answer that. I mean, for me, it's been, I can't.
Are there any other rumors you guys have heard of?
The rumors I shared were the ones that I've heard of, the ones that I shared. David, Keith, anything else?
Just reiterate to the public, anybody that were to test positive for COVID-19, that is a reportable illness to the public health authorities. And we are no different as a school district. If we came across a case that was positive, we would certainly report that immediately to the public health authorities, and then we would start coordinating with them the response. And the response would be specific to that specific situation. But we would have guidance from public health.
Mr. Gowan,
Yes,
correct?
ma'am.
What's your title?
I'm Director of Safety and Security.
Good job. Okay. Thank y'all very much for coming. Before you do leave, I want to thank my board members for being here and supporting us in this effort as well. We have our president, Mr. Darrell Morton. I saw Mr. Lester Miller, who is there, and I saw Dr. Sandra Woodford, who is right there behind our reporter. I think that was all of them, and I want to thank everybody for helping us get the word out. This is important, but I think it's more important that our community knows that we're working together, we're being transparent, and that we want to know what's happening. If you think you know something, call us, email us, send us a let's talk so we can get to the bottom of it. Don't act on rumors. Do as you've heard here. Bring it to the source so we can deal with it. Thank you very much for coming. Thank you, sir.